To raise business risk awareness and develop knowledge and understanding in the assessment, monitoring, and control of business risks. To enable the learner to develop an appreciation of the implications of business risks. Risk involves uncertainty, the probability that things will go wrong or exceptionally right. 0-2 risk occurs when the outcome of an event is not known. 0-3 if the outcome is known, there is no risk. 0-4 risk is mostly expressed in terms of probability. 0-5. Risk management is the process of identifying, measuring, and treating property, liability, income, and personnel exposures to loss. The ultimate goal of risk management is the preservation of the physical and human assets of the organization for the successful continuation of its operations. Risks to patients, staff, and organizations are prevalent in healthcare. Thus, it is necessary for an organization to have qualified healthcare risk managers to assess, develop, implement, and monitor risk management plans with the goal of minimizing exposure. There are many priorities to a healthcare organization, such as finance, safety, and most importantly, patient care. Risk managers reduce injury and manage incidents. Risk managers are trained to handle various issues in multiple settings. The duties a risk manager undertakes are ultimately determined by the specific organization. These professionals typically work in areas of medical administration, financing, insurance and claims management, event and incident management, clinical research, psychological and human health care. Emergency preparedness. Healthcare managers identify and evaluate risks as a means to reduce injury to patients, staff members, and visitors within an organization. Risk managers work proactively and reactively to either prevent incident or to minimize the damages following an event. Risk management. The systematic processes and procedures that an organization puts in place to ensure that it identifies, assesses, prioritizes, and takes action to manage these risks to ensure it continues to deliver its objectives. 0-2, 0-3, 0-4, 0-5. Primary concern is the provision of safe, minimal risk environments, care and services for its patients, staff, public, and commissioners. Enable the safest possible delivery of health care within the available resources. Provide a standardized, systematic mechanism to identify, assess, control, and minimize risks across the organization, principally through the development and maintenance of a risk register. Enable staff to undertake risk management as part of their everyday activities. Offers staff appropriate training and support in the principles and practice of risk management. Support the organization with continually improving services through the principles of risk management. Achieve compliance with statutory and national and statutory requirements. Develop the capacity to learn from mistakes, internally and externally, principally through the application of root cause analysis techniques. Identifying general risks. Think about the service you provide and consider these fundamental questions. What do we do? Who do we do it to? Who does it? When do we do it? Where do we do it? How do we do it? Do we learn from past mistakes? Undertaking a risk assessment can be subjective and will involve using professional judgment about what constitutes a risk. Individuals working within departments are best placed to identify risks in their own areas and understand the way to manage them. Types of risk include safety, reputational, resource. 0-2-0-3-0-4-0-5. Risks that could result in death, disability, or severe distress to patients and or staff. Risks that are less serious but are more frequent or could affect a large number of patients/staff. Risks that could lead to adverse publicity or affect the reputation of the trust. Risks that could lead to litigation or may be the subject of a formal complaint. Risks that could affect in meeting corporate objectives. Risks that could result in financial loss. Risks to service provision. Risks to equipment/building. Identify a lead person to take responsibility for the development and review of the risk register. Identify a general list of risks that are specific to your directorate/department/ward. Use the risk assessment matrix to assess the likelihood and consequence of each risk. Log your risk on the risk register, including the following for each risk you have identified: sources for risks, title code description, audit, complaint, strategy, incidents, external regs, health and safety risk assessment. Other risk assessment. Identify any existing control measures in place to prevent the risk occurring or reduce the potential impact if it occurred. Consider whether the controls already in place are adequate. Score the risk. Describe additional action that must be taken to manage the risk and the level of resources required to manage it effectively. Reduction. Taking action to reduce the likelihood or impact. Avoidance. Doing the job in a different way so that the risk does not occur. Transfer. If you cannot manage the risk, transfer it to someone who can. Acceptance. If the risk is small or cannot be reduced, avoided, or otherwise transferred, you may have to accept the risk and prepare a contingency plan. Business risk management is a structured and disciplined approach aligning strategy, processes, people, skill, and information with the purpose of evaluating and managing the uncertainties the business faces as it creates value. This risk is the current and prospective impact on earnings or capital arising from adverse business decisions, rude implementation of decisions, or lack of receptiveness to industry changes. This risk is an area of the compatibility of an organization's strategic goals, the strategies developed to achieve those goals, the resources organized against these goals, and the quality of implementation. This risk encompasses a large range of risks that can get in the way with achieving business objectives. It often stems from profound within the spirit of the business, events, in its systems or management controls and practices. It often stems from profound within the spirit of the business, events, in its systems or management controls and practices. 020300405. This risk, often called reputation risk, is a type of threat related to the trustworthiness of business. Damage to a firm's status can result in lost revenue or destruction of shareholder value, even if the business is not found guilty of a crime.